Greetings from Korea. My name is Junho Kwon, the director of the Korean National Institute of Health. It is my great honor to share my experience and the lessons learned on responding to COVID-19 in the Republic of Korea. Next. First, I will briefly go over the current situation in Korea. Next. In Korea, the peak of the transmission so far was on February 29, with a record of 909 confirmed cases in a single day. After that, newly added cases have slowly decreased. Since March 12, the number of daily confirmed cases decreased on the 10th year early May. However, after relaxing to a new routine distancing in daily life, the number of cases has been increased due to the cluster transmission continuously occurring in the Seoul metropolitan region and others. Next. This graph shows the total number of confirmed cases as well as cases discharged or released from isolation, and the cases in each day since the first case was confirmed. As of 16 July, the total number of confirmed cases is 13,600, including almost 2,000 imported cases, of which 12,300 cases have been discharged from isolation. Newly confirmed cases are 61 in total, including 14 new local cases and 47 new imported cases. Next slide. Since May 6, the number of confirmed cases have been increased and more local infections are reported, but this week the trend has been changed. Recently, the number of daily new imported cases is likely to exceed the number of local cases. Next, previously, most imported cases were from Europe and Americas, but recently the imported cases are mainly from Asia as well as America, Europe, and Africa. Next. For last 2 weeks, almost the half of new cases are imported, and 35% and 8% are local clusters and the contacts of previous cases respectively. And just 3% of cases has occurred at hospitals, nursing homes. Next. Now, I would like to emphasize how important public health emergency preparedness and response is in the next part. Next. Actually, our efforts for public health emergency preparedness and response has started right after MERS outbreak in 2015 until COVID-19 outbreak. After WHO Korea joint mission on MERS outbreak in 2015, the important recommendations has made. First, early identification and monitoring of all contacts. Second, regular provision of information to the public, including prompt information sharing. And third, strengthening capacity of medical facilities, including training experts for infection control and prevention, as well as laboratory. Next slide. Based on the lessons learned from MERS, KCDC has gone through the reform in its organizational structure and system. We have introduced and established the new infrastructure and systems while expanding and reconstructing our existing health system and public health personnel. Next. These are the measures that we have taken different from MERS outbreak in 2015. We have concentrated on risk assessment and risk communication domestically, as well as internationally, and strengthen the full engagement of local and multi-sectoral collaboration. Most of all, early detection through rapid testing and active case finding, as well as contact tracing, has been the key approach. Next. This slide shows the timeline, the progress of the situation, and how our government responded to COVID-19. After the cluster cases of unknown pneumonia originated in Wuhan, China, were first reported, we issued Alert Level 1 and began to prepare for possible importance of COVID-19. The alert level increased to level 2 when the first case was confirmed in Korea, and then to level 3 after more imported cases were confirmed. Secondary transmissions were reported after that. Finally, the alert level was raised to level 4, which is the highest level in response to the big clusters in early February, such as Shincheonji in Daegu and Danam Hospital at the Gyeongbuk province. Next. Again, after 2015 births, KCDC established the National Laboratory System. We are operating tiered laboratory network from the national to local level that is evenly distributed throughout the country. We also established specimen transporting arrangement within 24 hours for confirmatory testing even before COVID-19. Finally, we have established the emergency use authorization system, which permits temporary use of unapproved in vitro diagnostic devices during infectious disease outbreak. For COVID-19, we used this system for real-time RT-PCR testing kit. Next. It is well known that Korea has conducted extensive lab testing and found cases in early stages. In the beginning of the outbreak, only KCDC is available for laboratory testing, but later on, it expanded very quickly to the Research Institute of Public Health Environment affiliated with local governments, private medical laboratories, and hospitals till very early February. Therefore, currently, we have a total of 127 testing institutions available, and the average testing capacity is 20,000 per day, and maximum is 30,000 per day. Next. These are pictures of drive-through sample collection and screening clinics. These drive-through clinics has contributed to rapid testing. We also introduced walk-through station and other types for better work. Next. I'd like to point out our contact tracing strategy. There are mainly 4 steps: investigation, risk assessment, contact classification, and contacts management. At the investigation step, we obtain preliminary information through interviewing the patient, primary physician, and family to compensate missing information or confirm the interview outcomes. And then we collect additional information at the stage of risk assessment of the case. Information such as medical records, mobile phone location using GPS, card transaction log, and video footage are collected and investigated in this stage. Based on this information, we classify the close and casual contacts and provide guidelines from movement restriction to symptom monitoring. Next. This timeline shows the various response measures Korea took along with the progress of the outbreak, especially after finding out local transmission, including the Shincheonji cluster, which is the largest cluster in Korea. We tried to consider and conduct appropriate and effective measures for each phase of the outbreak. In response to the increase in case fatality rate as a mitigation strategy, we established a new system to focus more healthcare resources on severe cases. First, we categorize confirmed cases into 4 categories: mild, moderate, severe, and very severe. Each category receives different treatment and gets admitted to different types of facilities accordingly. This was very important in ensuring sustainability of our healthcare system in Daegu City and Gyeongbuk Province, where we had big clusters. Next. This slide shows the living and treatment support centers for mild cases. If these mild cases develop severe symptoms, then they would be transferred to hospitals for further treatment. Next. We also further adopted information technology for efficient and creative measures such as the self-help check mobile application, as well as self-quarantine safety and protection application. Next. After the peak of the transmission on February 29, we started recommending the public to practice social distancing. Public compliance to this social distancing campaign was generally very high in Korea. On May 6, we transitioned to a new campaign called A New Routine Distancing in Daily Life to advise the public to continue to practice social distancing while pursuing their daily life activities. The campaign advises including staying home if you are sick, keeping a distance of 2 arms lengths between people, washing hands, coughing, sneezing into your sleep, ventilating and disinfecting regularly, and keeping in touch with family and friends while maintaining physical distance. We are trying to help all Korean people integrate these precautions as part of a new daily routine in their lives. We still need to learn more about COVID-19. Till now, we have known that COVID-19 is highly infectious from its early stage and spreads rapidly with cold-like symptoms. New technology is required to enhance our traditional control and response measures, as well as to develop novel measures. Sharing the knowledge and practices each other would be the key to overcome the current global pandemic. Thank you very much.